Hi, everyone. Thanks so much for joining us. This podcast is to help you, our listeners, figure out how to find the best mental health care for yourself or for someone you love. So this is a newer podcast for us, and I'm delighted to have Cindy Brom, who is local here in the Chicagoland area, as our guest today. And we are going to be talking about how to find the right therapist. This is just the perfect place to start because finding that right fit, we all know, can make the difference between somebody staying in therapy, getting the help they need in therapy, or moving on. So I'm delighted that you're going to help us talk about this today, Cindy. But let me tell you folks a little bit about Cindy Brom. Cindy is a senior business development strategy and operations leader specializing in higher levels of care for behavioral health. With direct experience launching and overseeing intensive outpatient and partial hospitalization programs, Cindy has also served as a senior leader for providers in residential and inpatient levels of care in Illinois, Washington, and Colorado. Bringing 13 years of management experience serving patients with eating, mood, and anxiety disorders specifically, she also provided business development services for a substance abuse recovery provider in Chicago. Before beginning her mental health career as practice manager for the Department of Psychiatry and Behavioral Sciences at Northwestern, Cindy, you're a real slacker here, my gosh. Cindy was a consultant to growing ventures in a variety of industries, helping more than 100 companies replicate and grow their businesses throughout the country. Cindy earned her MBA from the J.L. Kellogg School of Management at Northwestern University and a BSB from the University of Minnesota. So very, very qualified to help us with this topic today. Welcome, Cindy Brom.
Thank you, Margo. Great to be here.
I'm so glad to have you here. I love this topic. So let's just dive right in. Cindy, let's start with what makes it so important to find the right fit in a therapist.
Okay, and I do want to give you a disclaimer. As you heard my bio, I am not a clinician, but I do have about 25 years of experience in mental health on the business side, so I definitely have opinions. There's been so much change in our field over the last 20 years. It's just a constantly changing thing. It's just overwhelming for new people coming into mental health to even know what questions to ask. Mm-hmm. It is also such a dynamic field. It's really fragmented. There's been a lot of big business and private equity and venture capital and hospitals behind mental health. There's constantly new types of treatment that's evolving. The Parity Act, which happened, starting really like in 2008, but Obama was really instrumental in enforcing it in 2013, had a huge impact on levels of care and how the insurance company reimburses and what they will provide. It's a really dynamic industry, and it's hard to weed through what questions to even ask if you're new. Even if you've been in it for a while, it's kind of hard to navigate. Access has been tough historically in mental health.
It definitely has been tough for sure. So Cindy, do you mind just describing for our listeners, because these are probably consumers of mental health, what is the Parity Act? And then let's talk a little bit about, we're just going to dive into, how do you find the right therapist for yourself?
Yeah. Okay, Senator Paul Wellstone, I think he was Minnesotan, and Dominici, I think was his colleague, way back in the mid-90s, started really pushing for parity, which in substance use and mental health. So really promoting that mental health services would be covered on par with medical services. So a simple example I always use is, if your insurance plan covers cardiac rehab after you have a heart attack and are in the hospital, it has to now cover mental health services. So a lot of, that in the 90s when I first got into the field, many insurance policies would have 10 days max all year. That's all you could get, or a
Mm-hmm.
certain dollar limit. And there were a lot of problems with inadequate care. So it's just on so many different levels with substance use and mental health care that it was pressure from the government to make insurance companies offer coverage of services, which is kind of in question at the moment. There's been a lot going on in the last 15 years, but recently there's some pushback that they're not necessarily going to enforce the Parity Act. So again, constantly changing.
Well, exactly. So, folks, for those of you who are consumers who are interested in finding mental health care, the good news is, well, certainly in the state of Illinois, parity is going to continue. That's been signed into law. But at the federal level, that might be changing. So and we have listeners across the country, so for the other podcast. So I'm assuming here too, state to state, it might be different. But the idea being that legislators have recognized, because their constituents have talked to them about this, that covering mental health care is imperative. So right now, chances are really good, folks, that your insurance would cover seeing a therapist for once a week for as long as you have a need, and your therapist can say that your care is requiring that kind of intervention. So we'll have some conversations on the podcast about audits and other things that can happen. But right now, I think it's a good thing for people to know your insurance will likely cover your care, and you can check. You can call your insurance company and find out. But that said, how do we find the right therapist? So what are some of the most common mistakes, Cindy, that people make when they're trying to find a therapist?
That they don't prepare enough. They don't think about what they want. They respond to marketing on a website. They go by what's easy, like a referral. But there are so many different types of therapy and specialty. You can kind of break it down like psychodynamic versus skills, which is kind of going deeper about how you think and you feel, like psychoanalysis versus maybe shorter term therapy. It depends on what you're seeking therapy for. So you really have to be honest with, what is it that I want? And you have to be honest with your therapist. So I'm talking not about just outpatient therapy, but higher levels of care as well. There are just so many different options, and it really comes down to, I sort of feel like, again, I'm not a therapist, but what I've seen in my 25 years in this field is what makes people recover or heal or have symptom improvement. And it comes down to just a few things. And people don't even really know necessarily, if they don't put some thought work into, what is it that I want out of therapy? Who can best deliver that? And one big component of it, Margo, as you know, is connection. Connection either with peers or rapport with your therapist. Those are two major elements that help people just skyrocket in their improvement. Mm-hmm. There's also skills, right? And awareness. So there's really those sorts of things. It depends on what you want, thinking about what you want. If it's kind of the rapport that you're looking for, if you're in the mental wellness sort of side, you're not seriously impacted by behaviors or thoughts or whatever it might be, maybe thinking about, who do I best establish rapport with in my life? Who am I looking for? Like, I used to think when I first got into the field, I'd be so embarrassed when I was young to try to tell somebody what to do as a therapist. And that really is wrong, because lots of young people want a young therapist. It just depends on who they connect with. Like, who is the best person? What's the best sort of treatment that is going to resonate with me to help me establish that rapport so I can be really brutally honest. And
that's it.
Yeah.
That's it. That was perfect, right, folks? Because I have been a therapist for 30 some years, and I'm thrilled to be having this conversation with somebody who isn't, quite frankly, because I think we talk about, it's like I can talk about what I do, but you're talking about it in this very adjacent way, which I think is really useful. But folks, what Cindy's referring to, there's reams and reams of research. Somebody's always researching everything. But there's reams and reams of research about the number one variable that helps people get better is that goodness of fit, that rapport, that connection with the therapist. Because to your point, then you can be more brutally honest. If you feel understood, you feel seen, you feel heard, feel like they get you, however you want to put it, you connect with them. And so, folks, that is mission critical. If you want to get into therapy, please interview, right? It sounds like you're saying people don't go in with enough information. It's like, well, this person has an availability. They take my insurance at this time. And right now it can be hard to find a therapist. And if you have the opportunity to interview somebody, it's a great way to go because you want that goodness of fit. So, Cindy, how would you go about interviewing somebody, or how would you recommend somebody else go about interviewing?
Yeah.
And first of all, would you ever see somebody who wouldn't let you interview them? I wouldn't. But
Yeah.
what do you think?
Sometimes I think it's tough in larger practices or busy people to take a lot of times. A lot of times people will give you 15 minutes. I think the place to start is the website, if they have one. If they don't have one, it's not the end of the world. A lot of therapists want to stay off websites, actually. But larger group practices, you can often find bios of the therapists and read all the bios. What is their specialty, their approach, their hobbies, their interests? What can you connect with? What do they have a specific expertise in your, like, whether you have an eating disorder, anxiety, whatever it might be. I wouldn't necessarily say no if I can't speak with the person for 15 minutes, but just even looking at their bio, because sometimes you really can't learn in 15 minutes. What are they going to do? They develop their spiel. It's like you have to kind of settle in for a couple of sessions sometimes to see, is this something that I'm going to vibe with? So looking on what's available online and asking questions like, does she or he have any experience with eating disorders? Or how long have they been in practice? What is their approach? Is it in person? Is it virtual? How often do they see somebody? Boy, there's such a difference, Margo. I mean, I am in business development, so I talk to therapists all day long and psychiatrists, and I have a database of about 1,500 people that kind of collaborate with my group, Simply Be, in Vernon Hills and Northbrook, in about a 25-mile radius, and they're so different. There are people who really will get on the floor with kids, or they really embrace learning and they embrace a certain methodology. There are people who take approach of temperament, like biotemperament, which is something really cool.
What is that?
Biotemperament is kind of like, what I know is one example is radically open dialectical behavioral therapy, which is so cool. It's kind of classifies people on a bell curve of over-controlled or under-controlled. So as opposed to, and a classic example is anorexia nervosa. Oftentimes with anorexia, you see a lot of over-control, high achievers, rule followers, grade A's, and they often really are less open, and so their temperament is to be more reserved, where you also have people on the end of the other end, under controlled, who just let it all go, and sometimes they have trouble with managing things in their lives. And even though you might have the same sort of anxiety disorder or whatever it might be, these two different kind of personality or biotemperament types that you're born with, and there's an element of nurture as well, really can be a way of addressing certain issues that are holding you back. So that's just one other section, right? That's not even having to do with connection, rapport, or skills, right? It's somewhat in skills because it's awareness. Awareness is really where you start a lot, which is kind of, I think, the foundation for skills.
Mhm.
Would you agree?
I would agree. And for those of you who aren't familiar with DBT, dialectical behavior therapy, or RO, radically open dialectical behavioral therapy, we're going to have Dr. Abby Brown, who's a local expert in RODBT, on as another guest. So we'll dive into that. But you're spot on, Cindy. There are so many different types of therapies. And that's a lot of what we're going to cover on this podcast so that people know what is RODBT? What is EMDR, eye movement desensitization and reprocessing? What's cognitive behavioral therapy? When would you jump into one versus the other? And so, to your point, as you're finding a therapist, you kind of want to know what your issue is, and then maybe ask them, with this kind of treatment that you utilize, how do you understand that being applicable to what I need? So, if somebody has, for example, an intense anxiety disorder, generalized anxiety disorder, they're just anxious constantly, is something like psychodynamic psychotherapy, meaning where we go back and look at your childhood and kind of dig in and try to understand how you came to believe what you believe, and how that may or may not be the best fit. Or for somebody who's struggling with that level of anxiety, you might need to do that work, but maybe something that's more skills based, because you've used that phrase, would be the way to start. And then you can move into that other treatment. So I'm really glad you brought that up. I think the average consumer doesn't necessarily know that. What do I
Yep.
need? Right? So talking to the therapist and saying, this is what I am struggling with, and maybe doing a little research on their own. What are best practices? What are the best treatments? And again, folks, be careful what you read online. You know that. You're all smart. You're listening to this podcast, so you're all smart. You know you have to kind of do your due diligence.
Yeah.
So how does somebody figure that out? So they're calling the therapist or they're reading the bio. How do they figure out what is the best form of treatment for them?
Well, I think at the beginning, if you're new to mental health, you really, I mean, we get calls, for example, somebody saw EMDR on TikTok, or I have autism because identify with somebody on TikTok. It is, if it's your first encounter with mental health, going into a specialty like that is jumping the gun, I think. It's kind of like medical specialties. You kind of need a primary care physician to start. You need a therapist. I wouldn't necessarily say generalized therapist, because actually nobody ever picks a general therapist. That's not what they're looking for. When somebody's looking for a therapist, I always say, they'll say, I want a woman in her mid 40s that lives in 60625 zip code and takes Blue Cross insurance and has experience with anorexia.
How does somebody figure out what type of therapy might be
Yeah.
right for them? I mean, the therapist
Yeah.
will give some ideas, but how do I know if I'm saying yes to the right thing?
Yeah. Yeah. So if you're newer to mental health and it's your first encounter, doing some research, but not necessarily going down the specialized route right away. I mean, you really think of two things. And I had this when I did my own therapy for a little while. I figured I better do this just because I need to talk the
Right,
talk.
right.
And one of the supervisors that was just a great psychologist, I told him about it in the elevator, and he said, you need to do two things. You need to be brutally honest, and you need to tell your therapist what you want. And I don't think somebody is going to necessarily say, I want EMDR if it's their first encounter. It's like, I want other things. Like, think about what you want. Can you challenge me? That's another big difference that nobody talks about in this field.
Mm-hmm.
I was very surprised, like the field of psychology, right back in the 60s, you might know more than, I'm sure you know more than I do about this, but was developed, the evidence was for success was supportive psychotherapy was effective no matter what necessarily somebody was doing. So some people like that, and some people need that, and some people want to be challenged a little bit more and be told. I don't think that is a very good coping mechanism, or some people want to be pushed a little harder. So asking those kind of questions of, how is your approach in talking with clients? How long does it take? What do you do in a session? are really good questions.
Those are great questions. And to your point, Cindy, I mean, I was alive in the 60s. I was a sentient being. Let's say that. I'm not going to go any further than that. I was a sentient being I was a kid. And so, yes, supportive psychotherapy for a long time. And folks, if you're not familiar with this, what that means is the therapist kind of nodded their head, and whatever you did, you were all good. And they were trying to be kind of nurturing and supportive, as supportive therapy would indicate. And that's evolved. We're not a blank screen anymore. People don't sit and, like Freud didn't face his clients. He didn't want to be a distraction. No, now hopefully your therapist is going to have some conversational skills. Now, Cindy, I've had people sit down on my couch or on a chair in my office, and I swear I could get up and walk out of the room and they wouldn't even notice I was gone because they just are so in their own process. I mean, I'm being silly, folks, but they needed me just to be a living, breathing human in the room with them until they could tolerate more. And that's fine. But folks, if you want somebody to challenge you, first of all, ask yourself why. Why do I want to be challenged? Because if you don't know the answer to that, they'll challenge you and you will bat it right back to them. But challenging meaning, not that they're confronting you, but saying, well, hang on. Can we think about that? Can we unpack that a little bit more? Have you talked that through with anybody else? So challenging or giving direction or whatever, I mean, that's all acceptable in the therapy space these days. If you feel like you need that, great. And you need to find somebody who will do that for you. But it doesn't mean they're calling you out or challenging you. It more means they're going to help you through Socratic questioning or whatever, help you think it through, feel it through. So I love that you brought that up, Cindy. So what do you think are some myths that need to be debunked about choosing a therapist? What do you think the average person might think that isn't true?
Oh, that's tough because it's so rapidly changing. But I think some people think that there's one way of doing it. Longer term therapy, psychoanalysis, like Freud did. That's the only way to do it. Some forms of treatment I think the biggest one is what they think will work and what leads to recovery. Like really what is the end result that you're looking for. Mm-hmm. It's like you hear these evidence-based practices all the time, starting with CBT. They call them third wave treatments, DBT.
Right. That's cognitive
ERP.
Behavioral therapy. Right. Exposure response prevention. Right. Yeah.
Yeah. It's on top of that, it's in mental health, it's really hard to track outcomes in mental health. Mm-hmm. Somebody who's been in the system for a while might see a therapist. They might be in the hospital for a while. They might have a residential stint or partial hospitalization or intensive outpatient stint, and then go to a different type of a specialist. So it's very difficult for this field to track outcomes. Especially long term, when it's very different than a cardiovascular surgeon who gives you the coronary artery bypass, and you're going to know in a couple months if you're going to have complications and get back in the hospital. It's so much easier for medical specialties to
Boy, Cindy,
measure.
That's right. That you are spot on. So, folks, if you're calling around and saying, "So, what are your outcomes? How quickly do people get better?" And if your therapist sort of stumbles around and can't answer that, it's not because they don't know what they're doing. It's because that's really hard to say. It's not that kind of thing. And we try to overlay or lay on top of what we're doing these kind of artificial ways of thinking about it. I think a better question is, how long have you been doing it? What kind of training do you have in the kinds of therapies that you're providing? I'm so glad you brought that up because there's a lot of buzz right now about outcome measures and how are people doing. And I've been doing this a long time, and I have some people who come in, they can do a quicker stint of therapy. They'll say, I want to get in, I want to get out. And there are other people who they've had a lot of trauma. This has been sitting in their brain, body, and their nervous system for 20, 30, 40, 50 years. That's going to be a very different trajectory. So I'm glad you brought that up. I think that's a really important point. So yeah. So the myths are that there's one way of doing this. The myths are that you don't have to sit on somebody's couch for 10 years. Other
right?
myths that you can think of?
That psychiatry is better than psychotherapy, because they're
Medication.
MDs. Because
Uh-huh.
there's that whole other issue of medications work sometimes.
Mm-hmm.
There's so much we don't know about medications. Like I talk to psychiatrists all the time too. And psychiatrists will even say, it's still such a primitive field. We still don't really know why some of this stuff works, if it
Mm-hmm.
does.
Mm-hmm.
And psychiatrists aren't necessarily, they're trained on the medication and medical and physiology and very different training than a therapist.
Very
And
different.
sometimes you can get really, really, really good, better care from a therapist and vice versa, sometimes better from a
Mm-hmm.
psychiatrist. A lot of times psychiatrists aren't doing therapy as much. Are you working a lot with psychiatrists?
Yeah, we have a team of prescribers, and some of them are very skilled at psychotherapy. We have a couple of folks who are therapists also. That's just part of their credential. But even those
Yeah.
who aren't, it just depends. And if someone's going to see a psychiatrist, Cindy, it sounds like you would suggest that they ask if they do psychotherapy or not, and what was their training if they're an
Yeah.
MD. But to your point, just because somebody has a higher credential, doesn't make them a better therapist, which is
Right.
stunning, right? Because some of it is just who the therapist is as a human. How much of their own work have they done? How much are they able to put their own stuff aside and show up for you? How well do they connect with another human? How much do
Yeah.
they understand about what's going on with you? So, to your point, you can't just look at the credential, which I can't tell you how many times somebody's called our practice and said, I only want to see a psychologist for therapy. Well,
Yep.
great. If we've got someone, I'm super happy to do that. And sometimes the person who has a master's degree might have more training and is better skilled. But trying to get somebody to understand that, they think, nope, higher level of training is
Yeah.
always better. So,
Right.
yeah, that's a good one. I'm glad you brought
Yeah.
that up. So, how would you suggest then? What would kind of your top three suggestions be for someone who is new to therapy or has been in therapy before, but wants to find a new therapist right now? Where should they go and what should they be thinking about?
I think they need to think, what do they want? What does success look like? What is it that you want? So, what's the end goal? So, you can talk about that when you make phone calls and do research.
Mm-hmm.
Who is the type of person, if we're talking outpatient therapy right now, if you're searching for one therapist,
Right.
because there's that whole other field, but who am I likely to be the most honest with?
Mm-hmm.
Is it somebody like, oh, she played basketball in high school too, or she played Division 1 and I'm a Division 1, and maybe we can talk about that to start establishing rapport. Like
Mm-hmm.
what are the characteristics of somebody that I'm most going to establish rapport with? Also, really, how convenient is it going to be for me to get there?
Mm-hmm.
Someone close to home, someone who's going to, be flexible. Timing is a huge one. There's such demand, right, for their outpatient therapy services right now, particularly doing this during the school year. Everybody wants to be seen from 3:30 till 9:30 at night, and those fill up quickly. So, kind of what's their availability, and what is their? Am I interested in doing worksheets? Are you going to give me homework? Are you? Is it just once a week? What do you do? What does that sound like? I might be willing to put in the work to do that.
Mm-hmm.
Those are the three.
I love those. Right. And I think your takeaway, bottom line, Cindy, is ask questions. Don't be afraid if you can. And if that's not your personality, folks, it just isn't. But you would do yourself a favor to do some research, ask some questions. Yes, the fact that they're in your neighborhood, the fact that they have an opening, that's great. But there's a very big difference, to your point, Cindy, between, like, let's take a child therapist, somebody who does play therapy and is on the floor using toys to engage a child versus somebody who talks to a child while they do tic-tac-toe. I mean, both could be fine, but what does your child need? Or for you, do you need someone who will give you worksheets, who will give you homework? Or do you think, I am so busy, I don't want to sit with somebody who's going to have that expectation that I'm doing homework during the week. I'm going to do my work while I'm here with you, or I need to see you virtually because I have 45 minutes I can donate to this a week or whatever. But to maybe sit down first, think about what they want, then find somebody and ask them those questions one way or the other, email, a phone call, or does it just say it blatantly on their website? All of that is definitely the way to go if you're going to engage a therapist. So, Cindy Brom, I love that. These are great suggestions. Thank you very, very much. I really appreciate your insight. Can you just say a little bit about how people can get a hold of you if they have some questions that they might like to ask you?
Oh yeah, they're welcome to call me at Simply Be Counseling in Vernon Hills.
We're in
They
Illinois. Yeah.
We're in Illinois, yes. And in fact, I'm going to give you my office phone number after I give you my email, which is cbrom, B-R-O-M, at simplybe.net. And my phone number, the best one to reach me at is 847-979-0535.
Perfect. And folks, we'll have that in the show notes too. But Cindy Brom, thank you so much. Simply Be is a very well respected practice in the Chicagoland area, folks. If you have questions, contact Cindy, contact her office. If you have any questions for me, I'm Dr. Margo Jacquot. I'm a psychologist. I'm from the Juniper Center, also in Illinois. I'd be happy to answer any questions. And you can reach me at margo@thejunipercenter.com. So, Cindy Brom, thank you so very much for being here with us today, folks. Thank you for joining us. We will look forward to having you here with us next time, everyone. Be well.